Hello, my name is Jason Kjono, PAC, Benefis Pulmonary. First of all, smoking is the #1 cause of COPD, which is chronic obstructive pulmonary disease, inability to get the air out. A secondary cause is emphysema, which usually leads to hypoxemia and reduction in oxygen saturations. One of the most significant parts is the increased chance of lung cancer in a patient that has a smoking history, whether they have a genetic component versus the extensiveness of their smoking. Smoking cessation is one of the biggest questions I get asked in pulmonary disease, and that is based on people's interpretations of what they can do to improve their health and how to quit smoking. There's multiple methods of quitting smoking, anywhere from cold turkey, which depending on the patient may be an option, cut down therapy, and or pharmaceutical companies have medications like Wellbutrin or Chantix that are very effective in smoking cessation. The biggest key for smoking cessation is motivation. Motivation to quit smoking is the #1 driver of how well a person can quit smoking. It takes an average of 5 times to quit smoking to actually be smoke-free. And what I usually tell people is that once you're a smoker, you're always a smoker, but whether you're actively smoking makes a difference in your long-term health benefits. Within the first 72 hours, the nicotine is out of the body, and there is some withdrawal effects, just like when any other types of medications or drugs that we use. So there is going to be a break-in period where the first 72 hours is kind of difficult on the patients, and we want to cut that with increased hydration, good nutrition. But the benefits of smoking cessation happen almost immediately after you quit smoking. Within 20 minutes, blood pressure and pulse go down. Carbon monoxide in the bloodstream goes down at about 8 hours. At 24 hours, your body is starting to revascularize, get more blood flow to the extremities. Into the 2 to 3 month period where we start seeing reductions in strokes and heart attacks, out to 1 year is where we normally see most people's pulmonary functions improve, and their breathing is better. They're less breathless, they have less irritant in the lungs. So it takes about a year to clear the toxins from the body, and we normally do see a natural increase in people's ability to breathe. Then we move farther downstream to the reduction in risk of stroke and heart attack, and obviously the biggest one is lung cancer. The farther we're away from smoking, the reduction in factors. Usually about 10-year factor, your lung cancer risks go down, and at about 10 to 15 years, they really stabilize. But as you progress in the smoking cessation program, very good effects happen in your body. Our body can reproduce some of the things that we've lacked when we were smoking. I get asked a lot about what's actually in a cigarette, and there's many carcinogens that are in a cigarette. First of all, you're burning something and taking it into your lungs, and your lungs get very irritated or inflamed from that. The toxins that include are very high in carcinogens, but also high in nicotine. Nicotine is actually the addictive part of smoking. And after we break the nicotine addiction, then it has to break the habit of when I'm stressed, when I'm having problems, when I go to use a cigarette for a tool to get me through that. Through all the research, 30-pack-year history of smoking puts people into a very high to a higher category of contracting some type of lung cancer. Lung cancer is a destruction of lung tissue and a tumor growth. It is a very advanced disease process in many people, and stages between 1 and 4. We do multiple things to reduce the risk chance of smoking-related cancer by #1, quitting smoking, #2, monitoring a patient's chest X-ray or lung functions to determine if they're long-term risk or is there any abnormalities on chest X-ray or CAT scan that need to be investigated. A question I get asked by a lot of patients is, how do I go about quitting smoking? First of all, I talk about the motivation and why they want to quit smoking and the health benefits long-term that will improve with reduction in smoking. The very first thing I talk about is the motivation of quitting smoking. What motivates them? Why do they smoke? When do they smoke? And we try to reduce those areas in time where they would actually go to smoking instead of doing something else. So alternate behavior, not smoking in your car, not smoking in your house, taking time in between smoking history. On an average, most people are smoking about 1 pack per day, so they're smoking a cigarette about once every hour. And so if we're doing for a reduction therapy, we try to cut that down by 5 cigarettes a week until they're completely gone. In the meantime, with the nicotine withdrawal, sometimes we use additive substances like nicotine gum, nicotine patches to cut the craving for nicotine and break the habit of smoking. Well, obviously, talking to your local physician or your primary care or any other health provider can help you set up a plan for smoking cessation. There's the website Quitline in Montana will also be a good reference. Um, Staying away from smoking, getting rid of all your ashtrays, staying around friends that are not smokers, and refraining from actually exposure to smoke will help reduce the triggers mentally. But with that, it as a conscious effort to reduce the nicotine abuse and addiction on a long road breaking the habit. A question I get for a lot of patients is, hey, I've smoked for quite a few years and I don't know if I have lung cancer or not. So the national guidelines for evaluation and treatment of lung cancer talk about a low dose lung cancer screening for people that have smoked over 30 years and over age 55. Now, lung cancers can happen in other age groups, but that is the highest risk factor for developing lung cancer. We have a protocol and a placement in Benefis system called the low dose lung cancer screening CT. This is a CT that is done for people between the age of 55 and 75 with greater than 30 pack year history or had quit in 15 years. That would indicate having a low dose CAT scan for evaluation once a year for up to 15 years unless you aged out of the program. It's a very good screening tool, helps us detect lung cancer at earlier stages and has better outcomes longer term. I get asked a lot by the younger individual, what are the downstream effects of smoking? At a younger age, most people don't feel the downstream effects or unaware of the effects that smoking can cause long term, and COPD being the biggest one. Most people don't know they have COPD until they're actually into the moderate stage or even into the severe stage. We underestimate our lung functions. We compensate on a daily basis of what we do to match our lung functions. So COPD is a big factor. It is one of the highest and leading causes of death in the United States, and it can be directly linked to the amount of smoking, when a patient starts, and how long they smoke for. One of the best tools is motivation. Being a motivated patient reduces the chance of continued smoking and increases the chance of quitting smoking quite significantly. Having a person close to you quit smoking is also a very good thing. Then we move into the tools such as patches, gums, lozenges for people that are wanting to quit but do not want to use a medication. After that, there is treatments including Wellbutrin, Chantix, and even in some patients, hypnosis can help. It doesn't matter what it takes to quit smoking. It is so important that we reduce the smoke in our body and quit smoking long term to reduce all the risk factors that are associated with COPD, emphysema, hypoxemia, and lung cancer. So if you need help quitting smoking, talk to your local provider, find out information on the web, but just quit. It'll save lives.